Well, good afternoon. My name is Lee Harris, Mayor of Shelby County and co-chair of the Joint Task Force. Pleased to be here. We are still in the fight against COVID-19. I know we have been in this fight for several months, but we must continue the course. We know, by the way, that this virus affects communities across our entire state, and there's not a rural virus and an urban virus. There's just one virus that we're all confronting right now. And it's important what happens in Shelby County and our urban areas, but also important what's happening in our rural areas. All of us around the state have seen various ups and downs, and all of us have to continue to work at this to mitigate the risk of spread. This afternoon, in addition to the usual reporting around the data and opportunities for questions, we have some very special visitors from Haywood County and the Brownsville area to talk about what is happening in those areas. Again, we know that what happens outside of Memphis and Shelby County affects Memphis and Shelby County. What happens in Memphis and Shelby County affects all the areas around Memphis and Shelby County. And so it is critical that we continue to collaborate, and there's been a great spirit of collaboration between all of the counties and leaders in our region, and so that collaboration will continue. Obviously, speaking for myself, we hope that we see a little more uniformity at the state level. It would be great, for example, to see a state intervention in terms of masks and some other protections that could apply throughout all the communities in our state. But until then, all of us have to keep working together, have to keep collaborating as local communities until we get a treatment or a distributed virus, or until we see an aggressive intervention from the state. We know that this continues to be important. Just yesterday, there was a report from Vanderbilt that suggests that the counties that had taken aggressive intervention measures saw half the number of deaths as counties that did not take aggressive intervention methods. So we all have to keep working toward this. We all have to continue to understand the science. It's constantly changing and becoming harder by the day, but we can make it to the other side of this, and we must continue the course. With all that said, I would like to invite to the podium and welcome the Mayor of Brownsville, Mayor Rawls. Thank you for being here.
Thank you, Mayor Harris, for inviting us down today. As we take a look at the process of mitigating this virus, we must understand this is a marathon. It's not a sprint. And as we get into a very, very critical point, we look at a triple threat: seasonal allergies, cold and flu season, as well as COVID-19 mitigation. It is very, very important. I'm begging you, I'm pleading that you take caution and an abundance of caution as you gather with your family and friends, and I'm asking that you postpone your gatherings to next year. It's nothing worse than taking actions or being not cautious during this season, during Thanksgiving, and have hospitalizations of loved ones and family members at Christmas that you won't be able to visit in the hospital. It's also crucial that as we start off 2021, that we're not making funeral arrangements for our friends and our families because we're not cautious during this very, very critical phase. I can't say enough to the Shelby County Task Force, to Mayor Harris, Dr. Sweat, Dr. Householder, for what you have done in being on the forefront of mitigating this virus. It affects our community as well as all communities. We are truly, truly in this together. We've seen the numbers rise and fall in our rural communities in Haywood County, and we don't have a hospital there. Our hospital closed in 2014. So we rely very heavily on the Shelby County Task Force, and the hospitalization rates that we look at here as well as in Jackson, Tennessee are numbers. They're family members and friends. When we have informal gatherings of our family and friends, that can turn from a cluster outbreak to a community outbreak in a very, very short period of time. One great example of that is in the 4th of July weekend. We put out public service messages asking everybody to mask up, to use abundance of caution, to wash their hands and social distance themselves. Well, people listened, but they didn't take heed, because 3 weeks later, Haywood County had the largest number of daily cases in the state of Tennessee. And as of this morning, 3 of the top 5 are still in West Tennessee in the Memphis and Jackson area. So as we continue to mitigate this virus together, it is important. it affects the White House, it affects the State House, and it can affect your house. It's important that you all take a simple precaution of mitigating the virus by masking up, washing your hands, distance yourselves, and do not let your guard down in informal settings with friends and family. We see a lot of people that are very cautious as they go into the public, but wearing their masks, and for that we say thank you. But we also have to be cautious as we go into our families' homes and our houses during this holiday season, during the cold and flu season, during the seasonal allergies, and then we're in a critical phase of mitigating the COVID-19 virus in our community. It takes all of us. So thank you so much for the cooperation. We'll look forward to working together in the future as we run this marathon that's not a sprint. And this time I hand it off to West Tennessee Healthcare. Thank you.
Thank you. I just want to thank Mayor Harris and Mayor Rawls and the task force for their leadership and all that they're doing to try to protect our citizens and our communities. I know that it is a marathon and we're all very tired, but we have a lot of work ahead of us. I want to share a little bit about who we are. I'm with West Tennessee Healthcare. I'm Amy Garner. I'm the Public Information Officer, and West Tennessee Healthcare is a healthcare system that operates 7 hospitals across West Tennessee, and we serve 18 counties in West Tennessee. We serve all the counties outside of Shelby County, Fayette, and Tipton County. So what happens in Shelby County and Fayette and Tipton, it has an impact on what we're doing in our region, and everything that's happening in our region certainly has an impact on what's going on down here. And over the last several months, our hospitals in West Tennessee have been treating COVID patients since the very beginning. A lot of COVID patients. As a matter of fact, when I looked at the data, it appears that we have been taking care of about 15% of the COVID hospitalizations across the state. So that's a large number of COVID patients, and that's not a record that we want. We don't want to see those high numbers of COVID patients. And just today, we're creeping back up. For the last month, a month ago, we had about 67 hospitalized patients in our system, and today we're well over 100, I think 122. So as you can see, those numbers are continuing to rise. I'm sure that they are here in Shelby County as well. And we have the holidays ahead of us. We have flu season ahead of us. And I'm going to echo what Mayor Rawls said and ask everybody to please be vigilant in gathering with your families. Make sure you're social distancing, washing your hands, wearing your mask, and even postponing those gatherings, as he mentioned. I'm going to ask Dr. Taylor, our Chief Physician Executive, to come and talk about some of the things we're doing to take care of our COVID patients.
Thank you, Amy. Thank you, Mayor Harris, Mayor Rawls. I'm a family physician. I've practiced medicine for 30 years in rural West Tennessee, and it's been a great blessing. This has been something we never expected, obviously. Just real quick, when the pandemic first started in March, we didn't have a lot. We watched Shelby County, we watched Nashville, and then August hit, and that's when our surge hit. We, at that time, as Amy mentioned, had 1/15. We have 1/10 of all COVID positive patients hospitalized in our flagship hospital in Jackson. We have 5 hospitals in rural West Tennessee: Dyersburg, Camden, Martin, Milan. And those all took care of their own share of patients. Currently, we had a drop-off in September. Currently, we're surging again. As of this morning, we had about 115 patients in our hospital and 90 in Jackson. Our ventilator patients are increasing. Some of the things that we've learned, one of the good, I'll say good things, is that we've learned to communicate better and work as a system, not only with our hospitals, but some of the other community hospitals in rural West Tennessee. We've had to work together to care for what you can so that we don't overwhelm our hospital. One of the things that we've increased our telemedicine. You may have heard a lot about that. One of the opportunities we've had is to increase our remote patient monitoring. We were one of the first in this country, I believe, to do that, where we were able to send patients home with home monitoring. They could set up an app on their cell phone if their vital signs got worse and they came back to the hospital. And we were able to treat about 300 patients that way, with about 30 of them being readmitted. So it also allowed us to keep up with our patients, and one of the frustrating things for COVID patients is not able to talk to their family. And we set up a virtual visitation with that, and also virtual consults for our physicians at our flagship hospital, our specialists, to help care for patients in our rural hospitals where they may not have those specialists, and allow them to care for patients there rather than transferring them. Some of the challenges we face, I think it's been mentioned, is our staffing. That's one of the critical areas at all hospitals. I talked to my colleagues in Memphis and Nashville. Nursing staffing, you may have heard that. Not only just a general shortage, but just the increased work for them, and also as they become sick and ill at times. So we're working aggressively on staffing. COVID fatigue. It's, as Mayor Rawls very well said, this is a marathon, and we get tired, but we need to press on. We have still have ways coming before vaccines, and I'll take care of it. We worry about our winter respiratory illness, our regular winter illness at this time of the year when our patient volumes go up. So the flu shot's even more important than usual this year. So make sure you do that. We don't need other illnesses if we can avoid it because we have plenty of COVID. The last thing is just a disconnect in our communities with what's going on in the hospital and healthcare systems. And that's where we've been communicating with Mayor Rawls and Mayor Harris and Conger and Jackson and Madison County and Mayor Young in Dyer County. They've all been very good at getting that message to the communities that what you do in the community affects not only you, but affects the healthcare system. And that you may not need to be admitted to the hospital, but as the ERs fill up, your wait times go, your surgery may get rescheduled. So it affects you a lot, not to mention just your own family members. So we appreciate this opportunity to speak and to share. And again, we realize how interconnected we all are, and we'll continue to function that way. So, Dr. Sweat, I believe you're next. I'll turn it over to. Thank you.
Thank you, Dr. Taylor. I'm David Sweat. I'm Deputy Director of the Shelby County Health Department, and I'm going to go over some of our numbers and also just bring a few things to light. We have crossed an important milestone today. We have 40,681 cases that have been diagnosed, and as a nation, we've crossed the 10 million mark. So yesterday we went over 10 million cases of COVID-19 disease diagnosed in the United States of America. We had 691 new cases reported here yesterday, but that doesn't mean that they were all infected in the past couple of days. What has been going on across the state of Tennessee this past weekend is a large amount of data being transferred through the surveillance system and put out for the counties to be investigating and be aware of, because the Tennessee Department of Health has been trying to catch up with some data transmission following some software upgrades to the surveillance system a couple of weekends ago. And we are now almost caught up. We are looking at that 691 cases that were reported yesterday. We feel like we're pretty complete through specimens that were collected through November the 4th, but we're still 1 to 2 days lagged between what we normally would experience and what we're seeing here. We hope to eliminate that lag by the end of the week. We've also had 589 deaths in Shelby County so far, and in fact, we've had 16 deaths in the month of November alone. So we do continue to be aware that although we are experiencing one of the lower mortality rates in the country, one of the lower mortality rates in the state of Tennessee, this is having a devastating impact on people in our community when they lose a loved one to COVID-19 disease. And 589 times that has happened so far this year. So working together, we can try to prevent that from affecting your family, from affecting you, and from affecting those who have already been affected even more. We are averaging about 300 cases a day being reported to us right now, and about 8.8% of all the tests that are taken are returning a positive result. But we still have plenty of capability in the community for people to be tested. And being tested is one of the first most important steps that someone can take to protect themselves and others. We have about 35 to 50% utilization in our community test sites, meaning there is widespread availability. anyone right now in Shelby County who needs to get tested, there's a place where you can go and do that. And if you have any signs and symptoms of a new onset illness, whether it's mild or more severe, please consider this. We are seeing that about 18% of the people that we've been interviewing lately had reported no symptoms, and yet they tested positive because they were part of some sort of exposure group. And they went and got tested, found out that they also had the virus. They were shedding the virus. And when we see people with mild symptoms, they maybe have a new onset cough or feel fatigued, maybe just feeling a little bit off, they do what we typically do in America. They just kind of push through and still go to work. Well, 1 out of 3 of the people with COVID-19 disease, we later find out were out in the community, going to work, going to school, doing their activities of daily living, going to church, and they were shedding the virus. And that's why the virus is spreading. So if you have any onset of new symptoms, we would say the best thing to do is to stop, go get tested, go home. Isolate for a couple of days until your results come back, just to be safe. And then when you find out that you have tested positive, then remain in isolation. We'll be in touch with you. But also, if you find out that you tested negative and you're okay, it was just a cold, it was something else, that's fine. Go back to work, go back to whatever you're normally doing. But take that precaution, because it may be protecting the people you work with, the people that you live with, or the people that you love. And then if you are reported as a contact because somebody has been out in the world and shedding the virus and you become exposed and we've identified you as a contact, or they've named you as a contact, and we put you into quarantine, one of the challenges that we're running into right now is there are people who are falsely assuming that that's just a recommendation. It's not something you really have to do. It actually is something you really have to do. And so we're wanting to encourage parents to remember that if your child has been placed in quarantine, they actually are in quarantine. They cannot go to school. If you work somewhere and we place you in quarantine, you actually are in quarantine. You cannot go to work. And perhaps Dr. Randolph will speak to that a little bit more as well. We are seeing an increase in school-age cases in the latter half of October, and we're averaging about 18 to 21 cases per day among school-age children in Shelby County. What we are finding in our investigations and interviews is that these outbreaks and these clusters of transmission in school-age children are very heavily driven by extracurricular activities. So cheerleading, playing on the softball team, playing on the volleyball team, being on a soccer team, being on a football team, or doing some sort of other extracurricular activity. We also see in our work settings that people are very good about using PPE when they're interacting with customers, or in the healthcare setting when they're going in to take care of patients, but they become lax when they're in interactions with their coworkers. They take their mask off in the office. They take their mask off in a break room setting. And then the transmission occurs peer-to-peer, sideways, inside an organization. We can stop all that if we just recommit ourselves to wearing a mask all the time when we're not at home with the people that we live with, to washing our hands frequently, to paying attention to our signs and symptoms, and if we begin to have any signs and symptoms that might be COVID, that we pull ourselves out of our situation, go get tested, go home, wait for the results. With that, I'm going to ask Dr. Randolph, our local health officer, come up and give his remarks.
Thank you, Mr. Sweat, Mayor Harris, all our guests. I'm Dr. Bruce Randolph, the health officer, Shelby County Health Department. Greetings, fellow citizens of Shelby County. Just want to echo what have actually already been said. I really don't need to add much to that other than saying, well said, and urging everyone to adhere to the recommendations that have been presented. But I do want to just remind the citizens that when you receive a call from the health department indicating that you have been identified as someone who's been infected with COVID-19, therefore you are a case, or that you've been identified as being exposed to someone infected, therefore you are a contact, and you are given verbal orders to remain at home in isolation or quarantine, that is a binding legal requirement. It's not a recommendation. And though you may not have received it in writing, you are expected to adhere to it, and violation of your isolation or quarantine is a misdemeanor. So we're asking that you cooperate so that we all can remain safe. Certainly want to emphasize the importance of continuing to wear your mask and maintain social distancing. I do want to also just mention on November the 19th, we will be conducting our Fight the Flu Tennessee drive-through event. We're encouraging all citizens to get their vaccine. The flu vaccinations is very important because we are actually in the flu season. If you have your flu vaccine, at least that would eliminate part of the puzzle that healthcare providers may have to deal with when you present with certain symptoms such as your fever, chills, and flu-like symptoms. So we encourage you to get vaccinated. And so on this particular event, between the hours of 1:30 to 4:30, you can receive a free influenza vaccine at two convenient locations. One is at Lamar Emission Station located at 1220 RKS Commercial Cove, and the other one is the Militant Public Health Clinic, 8225 Highway 51. And so that is a special event that is statewide to help fight the flu. Also, I want to echo what Mr. Sweat mentioned about the availability of testing. Currently, the utilization is ranging from 35 to 50%, so there's a lot of capacity. We urge you to be tested. You can have drive-through testing at two convenient locations, 3555 Appleton City Cove and 1720 RK Commercial Drive. Testing is important. If you have symptoms, get tested. If you've been around someone who's been infected, get tested. And if you want to know, if in doubt, get it checked out. Go get tested. That's the assurance testing. That's the surveillance testing that we encourage you. And lastly, I want you to stay home if you're sick or you feel sick. No need to try to be heroic and end up spreading the infection among your coworkers and family members. If you're sick, stay home. With that, I will open up for questions.
Brad Broders, Local 24.
Good afternoon, everyone. Question for David. My first question, based on the numbers we're seeing, how real do you think that there's been a Halloween-related surge, and how much does that alarm you as we're looking ahead to the holidays and more people being inside in colder temperatures? Then I'll follow up.
Thank you, Brad. Based on the data and based on the interviews, we would not necessarily say we have any signals here that indicate Halloween, specifically that day, drove any particular direction of the epidemic. In fact, there were certainly some gatherings. There were certainly some events that people did, but by and large, people in Shelby County did follow the recommendations and tried to have a safer Halloween. And so right now, we're not seeing any signals in the data that would say Halloween drove anything. But what we are seeing is the effect of being above 1 for our reproductive rate of the virus for a very long time now, since the end of September. And that has more than anything else to do with the increase in cases.
Thank you. And as a follow-up for Dr. Randolph, I know in recent weeks you and Dr. Haushalter have talked about it's not time to, at this point, to reconsider any adding of restrictions. But where we are right now, do you think we are potentially closer to the need for restrictions to return? And if so, what would potentially be some of the first that could return?
We're certainly monitoring the data closely and have some contingency plans that we've discussed. If, in the worst case scenario, things get worse, then of course we would have to backtrack, but that would be a decision that would be made not just by me or Dr. Haushalter, but primarily by the policymakers, the public officials, mayors, etc. But I envision that it would be more in a step fashion. That is, one, identifying where the increase is occurring. That's one of the reasons why we'll be able to become a little bit more focused and then try to address those particular establishments or facilities that are contributing to the spread. Could be some things like rolling back some of the times that we allow things to happen, et cetera. But we're still examining what would be the appropriate response.
Catherine Burgess, Commercial Appeal.
Hi, thank you all. Yesterday we got some news about a potential vaccine. I'm wondering if you can talk to us a little bit about the time frame for possibly seeing a vaccine in Memphis and how the health department is preparing for that and a possible distribution plan and that sort of thing.
We're currently having meetings discussing our plan in terms of the distribution of a vaccine when it becomes available. Just sort of in general, I would want the public to be aware that when the vaccine is available, it will be dispersed based on a priority. First, making it available to our first responders and healthcare providers and people who are at greatest risk of infection due to the fact that what they're doing as it relates to treating people who are COVID infected and our vulnerable population. And from there, we will dispense the vaccine accordingly. That particular area of dispensation falls up under the public health emergency response sector, in which Mr. Sweat is over. So would you like to address?
So first of all, I would like to say that we recognize that it's good news that the Pfizer vaccine shows some efficacy in its initial trials. They're still waiting for emergency use authorization, and Food and Drug Administration says they've got to get 2 more months of safety data before any vaccine would be approved to be distributed. And of course, once they do get approval, they still have to produce the doses and get that moving out. So in the near term, in the next few days, for instance, there's not going to be any vaccine available. But we are working with Tennessee Department of Health, and they are working with the Centers for Disease Control and the FDA. Everybody's laying the groundwork. They're planning. They're planning for how are we going to store it, how are we going to transport it, how are we going to get it to the places where it needs to be. So a lot of work is going on setting up those logistics right now in anticipation of vaccine. But in terms of when would it come, you have to expect it will be of several months at the earliest before any vaccine would arrive. But we are laying the groundwork and thinking through how it would be distributed in our community in cooperation with Tennessee Department of Health, and they're working with the Centers for Disease Control and FDA.
For my follow-up, considering that it'll be several months until we hopefully have the vaccine, once it is available, how long do you think it would take to distribute it across Shelby County, and what mechanisms would you expect to use to distribute it, such as drive-throughs and other things?
Right. Well, all of that is very dependent upon the vaccine requirements. So this particular vaccine, the Pfizer vaccine, has to be kept at an extraordinarily cold temperature, which will limit the number of distribution points that we can utilize. But there are other vaccines that are in development that may not have the same level of requirements to handle the vaccine. But what we would say is that as we get more details about the vaccine, the number of doses available, and what its requirements for handling are, then we will be able to talk to, answering questions about how many doses we have in Shelby County, who's the priority, all of that. Those are details that are still to be worked out.
Katie Reardon, WKNO.
Hi there. Yeah, my first question for you, David, is you mentioned an issue or a challenge of getting people to stay in quarantine. So I'm wondering, how are you finding out about that? Like, at what level are you able to monitor to ensure that people stay in quarantine? And just because I know we're running out of time, I'm also wondering, are we still on track to potentially hit 70,000 cases by the end of November?
Yeah. Thank you, Katie. A couple of different good questions there. And I think we will have to make this the last question. But so as far as are we on track for 70,000? No, we've pulled back a little bit. So that's good news. And we need to be grateful for that as far as people recommitting themselves to masking and slowing the spread. As far as the anecdotes we get about people not wanting to stay in quarantine, we get that feedback from, for instance, school systems and others who report that people are trying to come back to work, and so it's anecdotal. I don't have a lot of numbers on that, but we hear those stories. But at this point, we want to wrap up and just say thank you for your participation in the briefing today. Thank you for all of our partners and our guests who've come, and thank you to Mayor Harris.
Thanks, everyone. We'll see you back here Thursday.